Hello, I'm Dr. Sandra Freihofer, practicing general internist and liaison to ACIP, the Advisory Committee on Immunization Practices. Welcome to ACIP's 2021 Adult Immunization video series. The topic, flu vaccination. Here's what's new for 2021. One thing that hasn't changed: who needs flu vaccination? Everyone 6 months and older needs flu vaccination every year unless contraindicated. Each year, the composition of flu vaccine for the upcoming season is reviewed and updated based on year-round surveillance data from more than 100 national influenza centers in over 100 countries. The World Health Organization then makes specific recommendations, but then each country must decide. In the U.S., that decision falls to FDA's Vaccines and Related Biological Products Advisory Committee, known as VRBPAC. Its final recommendations are usually announced with a splash, usually by early spring, so stay tuned. So far for this season, flu has been very quiet and very mild. Social distancing, widespread masking, and hand hygiene have likely played a role. This year's fewer number of cases may make it a little more difficult to predict which strains will dominate next year. All flu vaccines contain protection from 3 strains, 2 flu A and 1 flu B. Quadrivalent vaccine provides additional protection from an additional type B strain. Most, if not all, flu vaccines are going heavy duty, trending toward quadrivalent versions. Trivalent versions will likely be things of the past. Let's review some flu vaccination basics. All vaccine providers should be certified in CPR and should be familiar with their office emergency plan. ACIP recommends that patients be observed for 15 minutes after any vaccination to decrease risk of injury in case of syncope. Most flu vaccines are grown in eggs, but 2 versions are totally egg-free. Cell-cultured inactivated influenza vaccine, CCIIV, its brand name is Flucelvax, and recombinant influenza vaccine, abbreviated RIV, its brand name is Flublok. They contain no egg protein whatsoever. All other flu vaccines are grown in eggs and may contain tiny trace amounts of egg protein. Let's review what to do for those with egg allergy. Those with egg allergy of any severity may receive flu vaccination. For egg allergic patients, the 15-minute post-vaccination observation period is no different. For those with egg allergy history of hives only, any flu vaccine is okay. The same is true for those with more severe egg allergic reactions, with an updated caveat. For those with more severe egg allergic reactions, more than just hives, here's what's new. Previous language stated those with histories of severe egg allergy needed to be administered vaccine in a medical setting under the supervision of a healthcare provider who can recognize and manage severe allergic reactions. New language states this medical setting caveat is not necessary for those with severe egg allergy if egg-free Flublok or egg-free Flucelvax are the products being administered. LAIV, the live attenuated influenza vaccine, aka the nasal flu vaccine, is also egg-based. It's a needle-free choice for healthy adults through age 49 as long as they're not pregnant. Its list of contraindications and precautions has been updated. Immunocompromised patients, including those with HIV and those with functional or anatomic asplenia, including sickle cell, should not receive LAIV. It's contraindicated for them. Pregnancy, cochlear implants, as well as those with any CSF cranial leaks are also listed as clear contraindications. Chronic medical conditions like asthma, diabetes, and other heart, lung, liver, and kidney diseases are listed as precautions. Recent use of flu antiviral medications is also a contraindication for LAIV because they interfere with its immune response. Some of the newer flu antivirals have much longer half-lives, and for this reason, LAIV should not be given if the person has received oseltamivir or zanamivir in the previous 48 hours, peramivir in the previous 5 days, or baloxavir in the previous 17 days. For older adults, there are some studies you may want to consider. There are 2 flu vaccine products especially designed for those 65 and older to improve immune response. The high-dose flu shot contains 4 times more hemagglutinin, 60 micrograms per virus, as compared to the 15 micrograms in standard dose vaccines. The only adjuvanted flu vaccine currently available adds extra boost from an adjuvant M59. These also trigger more injection site and systemic reactions as compared to standard dose vaccine. ACIP's comprehensive flu vaccination recommendation reviews recent comparative effectiveness studies of trivalent high dose, quadrivalent recombinant, and trivalent adjuvanted flu vaccine to standard dose non-adjuvanted vaccine. High-dose trivalent vaccine has been the most extensively studied. ACIP review states that evidence has accumulated for its superior efficacy and effectiveness compared with standard dose trivalent vaccine for older adults. The catch is that most flu vaccine is going heavy duty. It's going quadrivalent. Data regarding newly licensed quadrivalent high dose and quadrivalent adjuvanted vaccine is not yet available. Head-to-head studies of high-dose versus adjuvanted versus recombinant vaccine are limited. ACIP says this lack of data prevents recommending one vaccine product over another for this population, but that may change. Currently, ACIP does not make any preferential recommendations of one shot versus another. Getting vaccinated with flu vaccine product appropriate for age and health status is the goal. The important thing is to get one of them. For the American College of Physicians, I'm Dr. Sandra Freihofer.